Jagdish. Indians coming together, it is sometimes, it's not a rare entity, but wherever there is a food, we all gather. Now, today's talk, that what we have initiated for the community is very important. Diabetes and heart conditions are unique in Indians. Please note that throughout the world, no other ethnic group suffers as much as we suffer. For example, in 1970, I came to this country. I was in the medical school, and I came from Bangalore, and we used to see a lot of patients, big hospital, dying with infections, diarrhea, tuberculosis, meningitis, that and this. If you go to India now, you will see the patient hospital full of heart attacks. What happened? What happened? We are genetically prone for both diabetes and heart condition. Diabetes per se doesn't kill you. Heart condition kills you. Please note that. Every family, those who are sitting here, you must have seen. Oh, you got it? Okay, very good. So those who are, every one of you in your family, you have seen people have a stent or open heart surgery and whatnot. In Bombay, there is a club called 3 means 3 bypass, one group. They have their own club. They will sit in Gymkhana, kitna hai? 3. Next one will show 4. Next one will show 5. 5 bypass way. In the sense, it wasn't there before. When I came to this country, I saw patients were lying down also in the hospital with heart attacks. Now we don't see that many heart attacks. We are catching them early. We are catching them early before it hits you. That's why in the United States, all this research that what it took place has led us to believe. Please note that heart attack, heart conditions, diabetes, most of them it is preventable disease. Jo khayega, wo payega. Whatever you eat, laddu khao, gulab jamun khao, rasgulla khao, paratha khao, with all the, suddenly you see that you gain weight. So the weight gain is one of the big problems. But in Indians, weight gain is not the problem. We have developed a condition, what is called insulin resistance. They are skinny, vegetarians, and also their sugar is not that high. At the same time, their bad cholesterol is very high. We call it the metabolic syndrome. And that is very particularly in Indians is quite a different entity. That's why when I was the president of API, 65,000 Indian physicians, we put together a program called CADI, Coronary Artery Disease in Indians. Now we have come to know why we Indians are so susceptible for heart condition and diabetes. So therefore, please note that we are the smartest people in the world. I'm telling you. Mentally, or when the baby, in the uterus, in Indian babies, they are small. And there is an entity in the middle, somewhere we came to know that the mothers were not fed. Nutritionally, we did not have that much food to eat, and like here, prenatal, But what happened was nature protected the brain first, not the body. So in the whole interim, what happened? The body, these cells, they genetically coded not to respond to insulin. And they start developing what's called a little bit of fat accumulation. So therefore, we are Indians, even Pakistanis and Ceylonese, we are all in the same entity. They are mentally very bright, physically we are small, but genetically we are very susceptible for heart condition and diabetes. Both Sangeeta and Dr. Ahmed, they spoke already about diabetes. Now let me talk about what happened, why we are so susceptible now. That's what the question here is. This is the picture, you see that. This is for the great land, all of you have come, we have achieved our goals, but we have been heavily susceptible for heart conditions. This is what is called acculturation. Again, we learned this one from our caddy study. What is acculturation? It means those who are in small villages, you eat roti and whatnot, and you go to the, like Bombay or maybe Baroda, maybe Delhi, you study in the medical school, suddenly you see that all the American things look great. If you go now, every street, every beautiful place in India, in any big towns, what do you see? McDonald's, KFC, Domino's Pizza, Pizza Hut, and whatnot. This is what is called acculturation. It occurred. All of us became, suddenly we saw eating all this cheese and American food and whatnot. It is better than what we used to do, roti and dal and whatnot. Now the trend is changing. And that is also acculturation. But at the same time, what happened, after coming over here, a lot of stress. It is not easy. All of you have gone through this. You must have succeeded, but you have to work hard. You have to think about your future, you have to think about your family and whatnot. The stress created the more problems. If you take white people, 100 people versus 100 Indians, guess who has the highest rate of heart attacks? Indians. Out of 10, 6 Indians are susceptible for heart attacks. Whereas in 10, 1 or 2 Americans are susceptible for heart attacks. So it means that diabetes has created a tremendous problem. Heart attack also produces a tremendous amount of problem. And that has led from America coming to, just now Sangeeta said, that is absolutely correct. Diabetes is also very high in England compared to the United States. It could be one of the reasons, because of the reason, it is a smaller country compared to the United States and whatnot. There may be numbers are very small. But they came earlier than us. Here in 1970, people started coming in 60s. There in England and all, they started even before the Britishers left India. So therefore, there's a lot of stress. So therefore, we are genetically prone, stress, and all these kind of environmental factors like eating stuff made us to become more susceptible to vascular condition. Now, what is called the vascular complication of diabetes, that's what produces all the complications. Eye, vascular. Small arteries gone. Kidney, it is vascular. Major heart attack, that is the one which kills. That is exactly what diabetes kills. So diabetes control is very important. Please note that. Because half of if you control diabetes well with the medication and lifestyle modification, you can bring the heart conditions very quickly down. What is most important thing in diabetes is lipids, the cholesterol. Bad cholesterol and good cholesterol. Indians, genetically, we have a low good cholesterol. HDL is very low. If you take Indians all across, their cholesterol level may be 210. It is not that much. But the good cholesterol is like 13. 14 is very low. It should be like 40. So good cholesterol is also genetically somehow or other in Indians is very low. So with the result, what has happened, the bad cholesterol, even the cholesterol level may be normal, but bad cholesterol is very high proportionately. That's what really makes the arteries clog. May I have the next slide, please? This is what happens. Artery is like a tube. These are all cholesterol particles floating. And when it goes into the vessel, this is the wall. It starts growing and growing and growing and growing. One day suddenly it ruptures and it blocks the whole artery, produces a heart attack. It is so simple to say, but at the same time, that's what the mechanism is. That is the cholesterol deposit in the arterial wall narrows the vessel, with the result what happens, blood doesn't supply very quickly. May I have the next slide? Oh, pointer, okay. You have a pointer? Okay, sure.
Pointing.
Point it
To the
slide
slide projector.
With the projector.
Yep, that's how it works.
No, you go ahead.
Go ahead, doctor.
Okay, now I just want to touch base upon what these arteries are and how the heart attack occurs, and just I will finish my talk. Basically what I'm trying to tell you is this. These are the arteries. We are happy to have two great anesthesiologists here, and you have seen all this, a lot of Indians also coming and whatnot. These are the arteries by angiograms. You can see these arteries look angiogram, nice and clean, and very clean and going, and you can see all the branches are coming out like a root. Same thing, there is a major artery here. You see all the branches coming around. So heart is like a globe shape, and it has got these three major arteries. And these arteries, when they are clean, nice looking, the blood flow is easy and heart is functioning very well. But in the patient with the diabetes, those who have got high cholesterol, these artery lumen gets clogged, like what I showed you. May I have the next slide, please? See, this is what happens. You can see, this is another beautiful view. In this one, the artery is blocked here. It is hanging around like a thread. See, the artery that was flowing 100 cc of blood or whatnot, now you are getting only 5 cc. Suddenly you get up and walk around, get little chest pain, shortness of breath. And suddenly if it clogs, the whole artery is blocked and you get a heart attack. I will show you May 7th right here in this room. We are going to have another complete session on heart condition alone. I'm going to bring 2 extra speakers. Then for this all Indian community, we are going to have a whole discussion about the heart and heart-related conditions, because I don't want to really take much of their time, because there are other speakers are also waiting. I just want to show you what this means. So that is the blockage of the artery. You see here, this is normal artery. You see here, suddenly it gets cut off. That is exactly what we see day in and day out, all the patients, those who are coming for angiogram. And also you can see here that there is a blockage. So the blockages can occur anywhere. In this kind of a big artery, if there is a big blockage here, you can understand the whole heart will be, we call ischemia, or eventually if there is a heart attack occurs, it's a big heart attack. May I have the next slide? Just tap on it, it will give you, yeah, no, go back. Something you have to tap. No, go back. I think it shows.
Oh, it's not going to zoom on this.
No.
You're trying to zoom now.
No, not zoom. It is a video. Yeah, it comes out. Yeah, anyway, you play the next one. 1 second. No. There is to do it. No, you just put that slide. Go back. Okay. So anyway, this is one of the arteries is completely blocked. Go backwards. Go back. So go forward. Okay. Now, eventually, what it means is next one. I just want to hope this place. You can see this is the artery, and completely up to here it is normal, and suddenly there is a blockage. This is all cholesterol. See this? This whole artery is blocked, and also partially it is blocked here. I don't know how to play the.
Click on the screen.
Put the cursor and then click in the photo.
Is it on this slide, Dr. Naik? The video? The video's on this slide?
Yeah, there's a video on this also. No. If not, the next one. Next one, go to the next one. And play that one, see whether you can play. Anyway, what I wanted to show you, this is an angiogram, and there is a big, what is the cholesterol deposit, and no, it's okay, just leave it there, it's okay. So we are going to show this everything next Wednesday, the May 7th. So to make it, May 9th, I'm sorry, May 9th, 6 o'clock, we will have. So what it means is, all these arteries, what I'm showing you, they look very narrow. That's what it also causes narrowing in the leg, producing amputation, gangrene, and then the heart is the one which is finally produces the demise, or the most common complication of diabetes is the big heart attacks. And also these arteries, once they are opened up or a bypass is done, that is not the end of the story. Let me tell you, story does not end right there. You have to maintain these arteries open, whatever the bypass was done, whatnot. The best way to do it is you control your diabetes and the cholesterol level and exercise. Because if you go to India, anywhere, if you go to south, you'll see the rice like a big hill. Sambar put on. If you go to north, in Delhi, you see the roti or paratha, so much of butter on it. And if you go to east, particularly Bengal and all, rasgulla khao, keep on eating. But one of the most important... Gujarat, actually speaking, they eat more fat than anybody else. Yeah. Right.
To Anand, didn't you recently?
But the good part is, let me tell you, one more thing I want to tell you. We have a tremendous amount of vegetarian meals which can be modified. I don't want to go into that because it is a diabetes diet related. Probably Sangeeta can bring that some other time. But I want to impress upon you only one thing. Cardiac condition is the eventual condition in diabetes that kills you. And as I told you, it is a preventable disease. If you control diabetes well, bring your cholesterol down, sugar down, and exercise is very important. Even if you lose 1 or 2 pounds, walking 30 minutes a day, 30 minutes a day, whatever the walk, maybe 1 block, 2 block, maybe 1 mile, 2 mile, it's very important. So this is what is called the lifestyle modification. And the most importantly, I want to tell you, apart from the sweets and whatnot, alcohol. Stay away from alcohol as much as possible because it has a tremendous amount of calories. And the people don't realize. So, to make it very interesting, finally I would like to say this. No matter how you look at it, all the advancement that has been done in coronary artery disease and heart attack prevention and whatnot, the most important thing that you have to know is that once the procedure is done, that doesn't mean that every problem has solved. Before you go to that stage, work it out from today, make a decision that I really would like to get better. I don't want to go through that stage. You can do it. So you can do it, reduce weight, and also make sure that I have given the handouts. The portions that you eat has to be cut down. And thirdly, weekend parties, potluck parties, forget about it. Therefore you have to plan it in a right way. And the most importantly, the medications, particularly aspirin, is your lifesaver. Please note that. Baby aspirin, 81 milligram, or a full aspirin is a lifesaver. And second most important thing are the statins, like Lipitor, Zocor, Atorvastatin. All these statins have made a tremendous role. They have played a tremendous role in prevention of the heart condition, coronary artery disease, and sudden death and quadrants. Thank you very much for your attention.